Hey there, I'm Dr. Dan Orcutt, an orthopedic surgeon who's performed and helped over 1,000 patients recover from shoulder injury and shoulder surgery. If you're dealing with pain, prepping for surgery, or recovering, I'll break it all down so it actually makes sense. No fluff, no scare tactics, just real expert advice to help you heal smarter. Let's get into it. If you're even thinking about taking a shower after shoulder surgery, you're probably wondering how to do it without soaking your sling, slipping, or feeling completely overwhelmed. You're not alone. Showering is one of the most stressful parts of early recovery, especially during the first few weeks at home. In this video, I'll walk you through simple, inexpensive tools and strategies that make showering safer, faster, and a lot less frustrating. Most of these are under $30, and some you may already have at home. I'll also share a few common mistakes to avoid and tips I give my own patients for getting through those first few awkward showers. In the description down below, I will link to my Amazon affiliate store where you can find my recommended items easily. Let's start with why this feels so difficult in the first place. After surgery, your body is healing, your dominant arm may be immobilized, and you're trying to keep dressings dry while dealing with fatigue, soreness, and often medications. The energy it takes just to get into the bathroom, manage the water, and undress can feel like running a marathon. On top of that, many patients feel anxious or lightheaded, especially that first week home. It's not just a physical challenge, it's mental too. But this is where a few smart changes can make a world of difference. You don't need a total bathroom remodel. You just need a safe setup and a plan. The first thing I recommend to every patient is a stable shower chair or bench. This reduces fatigue, gives you a safe place to sit, and eliminates the risk of losing your balance while trying to soap up or rinse off. If you don't have a shower chair, even a sturdy plastic chair that fits inside the shower can work in a pinch. Next is a handheld shower sprayer. These allow you to direct the water exactly where you want it, instead of spinning around under a fixed stream. It gives you control, especially helpful when you're trying to keep one arm dry or avoid soaking surgical dressings. Non-slip bath mats are another essential. I recommend one inside the shower and one just outside the tub or stall. Wet floors and altered balance are a dangerous combo, and a simple mat can drastically reduce your fall risk. One thing I want to mention here is what not to do. A few common mistakes can make your shower routine harder, not easier. First, don't try to power through without sitting down. Even if you're feeling okay, standing the whole time increases your risk of slipping, and your energy may crash halfway through. Second, avoid wrapping your healing arm in multiple layers of towels or plastic without checking with your surgeon. Some DIY methods can trap moisture or put awkward pressure on the surgical site. And third, don't be afraid to ask for help. Whether it's adjusting water temperature or handing you a towel, a little support goes a long way in those early weeks. Let's talk towels. A small but helpful hack is sewing or safety pinning loops onto your towel corners. This way you can grab them with one hand or hang them in a reachable spot without the towel sliding off the hook or bar. It sounds minor, but it makes a real difference when you're working with one good arm. For those in the first 2 weeks after surgery, some may be told to avoid removing their sling altogether, especially if they haven't been cleared to shower yet. In those cases, you can use waterproof sling covers, or in a pinch, wrap the area with plastic wrap or a clean trash bag. I had one patient use a Ziploc bag and duct tape, and while I'm not officially recommending that, it shows the kind of creativity that works in the real world. Now let's cover what happens after the water is off. Drying off can be surprisingly tricky. If you're seated on a shower chair, drape a towel over your legs and let the water drip dry for a minute or two. Then use that one-handed towel loop system to pat dry, starting from the top down. Keep extra towels nearby, on a reachable stool, a rolling cart, or draped over the back of the chair. Speaking of carts, this is one of my favorite overlooked tools. A small rolling cart next to your recliner or in the bathroom can hold everything from fresh clothes to snacks, tissues, and your water bottle. If you prep it before you shower, you don't have to go digging afterward when you're cold, tired, and trying not to fall over. Let's talk clothes. After shoulder surgery, loose, oversized t-shirts work great. There are some shirts made specifically for post-op. I will link to them in the description. Lay your outfit out before you shower so it's ready and within reach. Sit down to get dressed. Start with the recovering arm, then slide the shirt over your head and through the other sleeve. Take your time. If you're finding this helpful so far, go ahead and like this video and subscribe to the channel. Every week I post new content to help you get through recovery with more clarity and less confusion. Now, what should you expect during weeks 2 through 6? Most patients will be cleared for light showers after their first post-op visit, usually around 10 to 14 days. You'll often be told you can remove the sling for showering but not use the arm actively. That means letting it hang gently at your side while using the other arm for everything else. This can feel vulnerable, so I always suggest practicing movements like towel drying or brushing your teeth while seated and supported. Also, some people feel most secure with a small, partially inflated beach ball supporting your arm at the elbow. This allows access to your armpit without having to use your muscles to hold your arm out to the side. Emotionally, this period brings frustration. You may feel stuck, dependent, or discouraged. That's normal. Showers are one of the first routines that help people feel human again, but they also highlight how much independence you've lost. Give yourself grace here. It will get easier. And each successful shower builds your confidence. By week 4 to 6, most people find their rhythm. You might not need the chair anymore, or you may switch back to a fixed shower head. But I still recommend keeping the sprayer, towel loops, and non-slip mats around. They continue to make life easier even as your strength returns. To wrap things up, let's review the essentials. Use a stable chair, handheld sprayer, and non-slip mats. Keep your towels reachable and consider a small cart to organize what you'll need before and after. Prep your clothes in advance and take your time. If you're cleared to shower without the sling, let your arm rest gently and avoid reaching or lifting. And above all, don't rush it. Clean doesn't mean perfect. It means safe, supported, and done on your own terms. I also want to answer a few questions I get all the time. One of the most common is, how often can I shower after surgery? For most patients, once you're cleared to shower, usually around day 3 to 5, you can shower daily as long as you feel steady and comfortable. Another question is, can I wash my hair? Yes, but gently, and only using the non-surgical arm to lift or rinse. A detachable sprayer is especially helpful here. And finally, should I use body wash or bar soap? That's completely up to you, but body wash in a pump bottle is usually easier to manage one-handed. Thanks for watching. If you'd like a free checklist to help guide your recovery week by week, including tips like these, you can grab that below. It's helped hundreds of people feel more confident during recovery. Also, check out my video on the first 6 weeks after surgery. It pairs perfectly with everything we talked about today and can help you know exactly when and how to move forward safely. The link is right here in the upper right-hand corner. You're doing better than you think. Be kind to yourself in recovery. You are strong and can do this. I'll see you in the next video.